SAHMRI acknowledges the Kaurna people as the traditional custodians of the Adelaide region, where our buildings are located. We recognise the Kaurna people's cultural, spiritual, physical and emotional connection with their land. We honour and pay our respects to the Kaurna elders, both past and present, and all generations of Kaurna people, now and into the future. We acknowledge all other traditional owners who live across South Australia, with a special thanks to those whose lands we visited in the production of these videos. This video has been made for general information only and should not replace medical or professional advice. Speak to your health practitioner if you have any questions related to your health or medical condition. The South Australian Aboriginal Chronic Disease Consortium does not specifically endorse any medicines or treatments described in this video. Aboriginal and Torres Strait Islander viewers are warned that the following video may contain images and voices of deceased persons.
We spend a lot of time talking to communities about the health conditions that worry them most, and diabetes looms large as a critical cause of concern in Aboriginal individuals, in their families and their communities more broadly.
There are really two main sorts of diabetes, type 1 diabetes and type 2 diabetes. There is also a third type of diabetes called gestational diabetes that women sometimes can get in pregnancy, but for the most part we think of type 1 and type 2 diabetes. Type 1 diabetes is a condition that we used to think mainly affects children and adolescents, or starts off in children and adolescents and then lasts for your whole life. In this condition, your body's pancreas doesn't make insulin at all, or makes so little that you need insulin from outside by injections so that your body's blood glucose levels don't rise very high.
Tiani shares her story of being diagnosed with type 1 diabetes at age 16. Her story shows how type 1 diabetes can quickly become a medical emergency.
My story started when I got sick. That was it, pretty much. It just kept going on, and then eventually I got too sick. It was about 8 weeks. I hadn't drank water or eaten food. I couldn't do anything. I lost a bunch of weight, and I can remember the morning like it was yesterday. I will always remember it so clearly. I woke up in and out of consciousness, and when I woke up in immense pain, my back was hurting, I couldn't move. So I kind of freaked out and found my mum eventually, yelled at her to take me to the hospital. When we got there, they put me in a wheelchair. They didn't know what was wrong with me. I didn't know what was wrong with me. And then my doctor came in and asked my mum if she's had insulin today. And she said, no, why would she? He goes, because she's type 1 diabetic. And I was like, what does this mean? I don't understand what's happening right now. I do remember thinking that I might die, and I don't want to sound over dramatic, but the pain that I felt was so overwhelming, and I didn't know what was happening to me.
Sarah Davey, a diabetes educator at Port Lincoln Aboriginal Health Service, and Dr. David Jezediason explain how type 2 diabetes is different.
We've spoken about type 1 diabetes and how that is a very sudden onset, that their body destroys the pancreas and the person is not able to produce insulin anymore. With type 2 diabetes, there's a problem with the pancreas producing enough insulins to be able to allow the body's energy source, sugar, to end up in the muscles. So that just doesn't happen suddenly for type 2 diabetes. It's a progressive condition where the body over time ends up with higher than required blood glucose levels.
The majority of people with diabetes, about 90%, have type 2 diabetes. This usually occurs in later life, so after the age of 40. However, in Aboriginal populations, because diabetes runs so strongly in families, we sometimes see people with type 2 diabetes even as teenagers. In type 2 diabetes, we don't usually have to start insulin straight away. In type 2 diabetes, we can usually suggest all the lifestyle changes such as weight loss if needed, a good diet, exercise, and then start oral medications such as metformin. And only when diabetes isn't well controlled would we then need to use insulin.
Type 2 diabetes is a progressive condition. You may have diabetes and not even know. It is very important to have a yearly health check to pick up any problems early. As you'll hear next, both George and Pauline were surprised to find out they had type 2 diabetes.
One of these persons that never visited a doctor or never been sick, or used to, whatever sickness or illness I have, used to treat it in a cultural way. But in 2010 I was diagnosed with a bit of prostate problems in me, and eventually flew down to Adelaide, and through there I was diagnosed that I had some type 2 diabetes with me. Yeah, and it sort of all started from there. And then I never knew anything about it. Diabetes, you hear it on the radio or the television of what other people talks about, but you think it never come to you, but eventually it did. When I got diabetes, I wasn't like some of the other people. A fear comes on you. But what happened was that I was one of these fellows that, because I thought I was healthy, I was working, I'd done a lot of exercise in the mining area, and so I thought, oh, so what? It's just another symptom, And eventually I understood that I was diagnosed with type 2 diabetes, which meant that I had to be on tablets probably all my life. I had to change my diet, that sort of thing, and my other doing exercise and all that sort of thing. So at that time, in the beginning, I didn't have any fear of it, but as I understood it more, I understood the seriousness of it.
I think I was about 45 when I first found out that I had diabetes. And crazily, like when I look back now, I did have red flags along the way, but I really didn't believe that I would, even though my mum had diabetes, my dad had diabetes. For some reason, I just had in my mind that I was far more active than what they were at my age, I suppose, and didn't believe that I would get diabetes. And as I look back now, I realise that was some crazy thinking. Because I did have gestational diabetes, and even though I sort of looked after myself really well through my pregnancy and probably should have been much more aware, I still did not believe that I would end up being a type 2 diabetic.
If you're living with diabetes or concerned that you may be at risk of diabetes, it's very important that you are linked in with a healthcare provider as a regular process of visiting for healthy checks. So I invite you to visit your health centre, your health service, and ask, what is my diabetes risk? Or if you are living with diabetes, ensure that you're regularly checking in with the health service to make sure that all of your kidneys, eyes, everything is all going well. Don't wait for symptoms to tell you that your diabetes has progressed or you have got diabetes. So within our health service, the team that we would involve in helping you to improve your self-management skills involves Aboriginal health workers, registered nurses, diabetes educators, dietitians. We have exercise physiologists to help with your physical activity levels. We have diabetes specialists called endocrinologists who visit us as well.
We hope you have found this video helpful. For further information and resources, check out the links on your screen now. The South Australian Aboriginal Chronic Disease Consortium would like to thank the Aboriginal community members and health professionals who participated in this video. This suite of diabetes video resources has been made possible by funding from Country SA PHN.